I get the 3 minutes and 44 seconds?
Brevity's a good thing.
I'm Eugene. I'm a partner in Health World Web, LLC. My previous experience is 7 years at a pharmacy benefit and technology planning. Dan Kogan, who's in the back, he's right there. CEO of Health World Web. His previous company, together with the founder of Adaptive Blue, was sold to IBM, Information Laboratory, back in 2003. Dan started this company in 2006, and in 2007 he launched the consumer-facing destination site Health World Web, where the sole premise was to help healthcare consumers follow other people's experiences and find the right resources. I joined Dan about 5 months ago, and together with our advisor, who's Esther Dyson, we literally switched a month ago our business model from a destination site to basically peeling off the veneer and using the algorithms that Dan developed to basically black box it. And the target here is the health plans, as well as benefit managers. So what problem we're really trying to solve with our social decision-making platform for healthcare. The commercial enrollment for the health plans is flat to none. Any revenue shifts are happening by stealing customers from other health plans. 33 cents out of every dollar out there that's spent on healthcare comes out of my own pocket, a consumer's pocket. So according to Deloitte consumerism study that just came out, 45% of consumers are willing to switch either physicians or health plans. So for these health plans, there's a problem. They need to differentiate themselves. They need to excite the consumers. And one of the interesting pieces is United has a division, Optum Health, which now delivers $5 billion out of the $80 billion revenue. And a portion of that revenue comes from building portals for private portals. One thing that I want to make clear that how do we solve the problem? We're actually not competing with the WebMD or Optum. We're a plug-in to basically provide intelligent recommendations based on the user's social graphs. So the other piece is we also provide feedback loop to the sponsoring organizations. And we can even play in the P4P market as well, pay for performance, which is a hot topic these days. And at the end, we enhance the consumer's decision-making abilities. Again, based on Forrester research, these moves by health plans are great, but all these portals are still missing the decision-making capabilities. Market landscape, I can tell you right now, I can take the 206 million users times 1% penetration and come up with a hockey stick. The approach we're taking based on our experiences in the Health 2.0 context, we're actually going to see some of the health plans, see the pain points, get that aha moment that we actually need to engage the consumers. This brings us to the critical success factors, which one of that is the marketing. The other piece, we have a strong team with healthcare and software packaging experience. The key pieces we're missing is product marketing and sales. And we also realize that it's really difficult to penetrate large health plans. So we're partnering with, in talks with a company like Benefit Focus that covers 60 million consumers. We're actually partnered with their media division, ICU, on our destination site, as well as Connections that already sells CRM solutions into health plans. So we're cutting that sales cycle down. And in closing, we'll be doing provisional patents. Joe Rayo will talk to you. We have a strong team and very focused approach in healthcare, even though we are domain agnostic. So we can span travel, et cetera, but we're focusing on healthcare. When was the last time $36 billion fell off the sky? And we're currently looking for a seed investment for a 10% stake.
So walk me through, I'm a person insured by a health plan, I got a medical problem, I got diabetes, I just got diagnosed with diabetes, and how do I experience your technology? Where do I go in this new model? Where do I encounter it? How do I interact with it? And what are you doing for me? Or what are you allowing that website to do for me that I couldn't get before that?
So we're actually starting with providing, so today, captive audience. Aetna, United, Kaiser, whoever has 1 million+ unique visitors. They need
and
to
these people are people who are customers of these health plans.
Correct.
And they're already going,
customers.
They're going to these websites, why?
Search for doctors mainly.
Search for doctors. Okay, so you're in the doctor search equation?
We are initially in the doctor search equation, but the engine is flexible enough to actually provide therapy recommendation based on other people's experiences.
Okay, so I come to Aetna, let's say they're my provider, and now I'm interfacing with your technology. What is my experience? What do I enter into the system? What do you ask me?
So we engage the users based on, and let me walk you through the use case initially with the Aetna guys, for example.
Right.
So we connect to their systems. We understand the profiles in their databases. We collect the claims data if they want us to. We understand their demographic data.
So Aetna already knows a lot about me because they have my records.
Absolutely.
Okay, so you're grabbing all that information.
Yep. Then we basically connect, now we create a 360-degree social graph based initially just purely demographic information. Now part of it is the social networking tools that we also have in the package, but we can have a lot of competition there like Jive, etc., and we can integrate into the existing portals, and they need to enable these social communication tools. So the other piece is, the latter piece is actually engaging that consumer to communicate. So today, actually yesterday, I was looking for a podiatrist, and I went to HealthNet, who is my provider. They listed me, 3 doctors. I have no idea which doctor is better, worse, or indifferent. I need to pick the doctor based on I'd rather drive 20 miles to see a Russian podiatrist because that's my background, versus somebody in the plan that's 3 miles away. So my personal preferences come into that equation.
And now Aetna is your customer in this equation.
Either Aetna directly or somebody, for example, like WebMD Health Services actually runs HealthNet's portal.
Got it. Okay. So they're your customer. You sell them the technology.
Mm-hmm.
Are you getting a license fee? Are you getting a monthly?
As I mentioned, we switched the model literally actually 3 weeks ago.
Right.
We're trying to get it to those aha moments and understanding the pain points and the dollar flows.
Right.
At the end of the day, per user per month, a lot of the benefit managers, HR services, that's what they charge per user per month. We license it out to the WebMD Health Services, or we're in conversations with small labs that actually have the social network component.
Okay. So I'll give you a couple of suggestions in terms of how to pitch this, and then I'll tell you what my recommendation is. I would pitch this in a simpler way. I would say that doctor search today is broken, and it's controlled by the healthcare providers. You got to go to the healthcare provider website to find a doctor, and all you're basically getting today is a white pages listing. I live in New York. I'm looking for a podiatrist. Here's my zip code. Here's 5 doctors, and that's it. And what you're doing is you're making intelligent doctor search. And you're leveraging the data that they have about me. You're leveraging other third-party data, and you're making a much better doctor recommendation. And you're getting paid as a on the per user per month kind of thing. That to me is a 30-second elevator pitch that everybody in the world can understand. And I think that's an interesting business. I'm not sure I would invest in it because your customer is the healthcare plan, and that's not exactly what our firm invests in. There's plenty of venture capitalists who I think would be very attracted to this idea, that they're looking to invest in information technology related to healthcare. They understand the HMO business model, and I think there's a business here. There's no question in my mind there's a business here. But I think you can simplify the pitch a lot, and you should really focus on finding some investors who have a good understanding of how the healthcare system works and like enterprise kind of sales, because that's really what you're selling. You're selling technology in the enterprise. I think the fact that you have a relationship with Esther is great. She's a real expert in this market. She's done a lot of conferences and stuff in this sector. I think having her on board as an advisor gives you great credibility. So that's my take on what you're doing.
Let me confirm, I'm Dan Cogan. So we do have a destination service today. And if you log in, we have about 2,000 providers with enriched, 2 million providers with enriched information about education, degrees, and we have the social graph overlay that data. So you can search, as Esther said, you can engage a user to be a partner in search, where you can say, these are my personal preferences, find doctor for me. Or it happens automatically, because as you browse and you connect and join communities, we learn. It's an adaptive learning system. We learn from you, and we start pushing little bit by little bit, and based on your response, we create a feedback loop, and we push very precise recommendations for doctors, other users, other communities around, other medical services that you and your family could be engaged in. So it's a referral system. It's an adaptive learning system, which is a destination site today, and as per many recommendations, we're looking into the white box, but the peach is fresh.
Right. Well, that's fine. I would say, just like the, I'm drawing a blank, I'm embarrassed, coveted list, right, which is vertical search of one flavor. I think what you're doing is basically vertical search. I'm a big believer in having a very simple description of your business. We do doctor search.